Hello, I'm Dr. Dennis McKenna. I am so pleased today to be joined by Chris Couchet, our System Chief Information Officer.
Thank you, Dennis.
Chris, it's great to have you here. Today is Thursday, June 2nd, giving you the update from Albany Med. All right, Chris, I'm going to pop through some COVID numbers, so just stand by. First graph here, New York State, people in the hospital with COVID, 2,459. Importantly, and you're going to see this repeated on every graph, numbers getting better than the previous weeks. Next graph, Capital Region. Again, people in the hospitals of the 8 counties of the Capital Region. That number is 172. And again, same story as the state. Those numbers are going down. Next graph here, admissions and discharges to the medical center. We're in single digits now per day. There was a time where the admissions per day may be 10, 12, 14. We're back to single digits, and of course, that's good. If you look at the morning census here at the medical center, we currently are at 55. A couple ways to break that down, Chris. 49 adult and 6 children. And the other way of looking at it is 46 on the floor and 9 in the ICU. The data I looked at this morning showed none on ventilators. That can change. But still 9 in the ICU. Overwhelmingly, those that are in the ICU, unvaccinated. Okay, very good. Let's pop it open the graph on variants. People are often interested in the variants. What you can see if you look closely all the way to the right with the dark purple, 60% of the variants in this region now are BA.2.12.1. Easy for me to say. But 100% are Omicron. 100% are Omicron, which really is good news. We've talked about this before. People may say, well, what is good news about Omicron? Well, what we know, of course, is that while it may be more transmissible, you do see these breakthrough cases even in vaccinated people. It is much less likely to land you in the hospital, certainly much less likely if you're vaccinated, much less likely to end up in an ICU. You know, when you think about 2022, Chris, and you think about where we are compared to 2 years ago, and I say this often, we're in a much different place than we were, right? So not only are the numbers coming down, but if you do get COVID, and people get COVID out there, we have therapeutics, right? So we have Paxlovid, an oral pill to treat for many people who qualify for that, and we still have monoclonal antibodies. So good news. And of course, the vaccine. And if we pop over in the next graph here, you can see vaccine effectiveness. We call this our red, blue, black graph. Just focus on the top, that black line there. That shows the likelihood of the vaccinated people, whether or not they end up in a hospital or not. And what you find is that for the fully vaccinated, the vaccine is 90% effective. 90% effective at preventing you from getting into the hospital. So still very effective to preventing the most serious thing, which is hospitalization. In the Capital Region, we're still inching close to a very big milestone. We currently have in the Capital Region, the area that we were the hub for the vaccine rollout, 971,000 vaccinated. So a couple of us, Ruth Leslie and others, still waiting for us to hit that 1 million number. All right, let's jump over into a couple other things, shall we? Great. Let's talk about an award that some people got here at the medical center. This is an Education Advocacy Award, and this was given out by the Brain Injury Association for New York State. Obviously, our sports medicine doctors, led by Dr. Hamish Kerr, as well as Dr. Brady Bowen and research coordinator Michelle Bowen on head injuries, concussions. Did you play rugby?
I did not.
Did you
Soccer.
play rugby? Soccer?
Soccer.
So you can get head injuries from soccer as well. I say rugby because Dr. Kerr actually is the U.S. Olympic rugby team physician.
Wow.
Yeah. But he's also a internationally known expert on head injuries and concussions. We're so fortunate to have him, as well as Michelle and Brady Bowen as part of our team. So congratulations on that award.
Great part of the mission.
Absolutely. Absolutely. Speaking of mission, let's segue into an area that you know a lot about, Care One. So when I say Care One, what does that mean to you, Chris?
So we have 3 different projects, Dennis. We have everybody's heard, we're doing this thing called EPIC, and that's our EMR, electronic medical record. We also have what we've already talked about, the ERP, which is our enterprise resource planning system. And that takes care of our supply chain and our financial reporting functions. We also have Workday already for our HR and our payroll functions here. And then there's a third part which kind of goes under the radar, and we call it Bring to Standard. That's all the technology solutions that we're putting across all 4 hospitals to bring us all up to a standardized platform of connectivity, of systems, of computers, of cybersecurity tool sets, things like that. So we have 3 separate projects that have been working since November.
So when we came together as a health system, we now have 4 hospitals in our health system. We have Columbia Memorial, we have Albany Medical, we have Saratoga, and we have Glens Falls. And of course, we also have the visiting nurses. But when we came together as a system, we brought with them the medical records they were on. In some cases, they may have a different medical record inpatient, different from outpatient, in some cases different than their urgent cares. The goal as a system is to have one singular platform. I call it the neural network across the system, correct?
Good way to put it.
Across the entire system. And on the ERP side, so that would be Epic in the health record.
That's right.
On the ERP side, it would be Workday.
That's right.
Recently with Epic, we had a milestone moment. What happened with Epic?
So happy to say that we finally signed an agreement with Epic. It is the first major milestone. It actually allows us to engage formally with Epic. Epic has already sent, in the week that we signed, they've already sent people on site. We've had meetings with their staff, with their project leadership. We also get to register our folks for training. So we'll be sending out a large contingent of people in several waves out to Wisconsin, to Epic's headquarters, to where they'll get trained and certified on the Epic products that they'll be working on during the next couple years.
Now, when you say send people out, do you mean only from this campus, or do you mean from all 4 campuses?
All 4 campuses, Dennis. So we'll be, we've got for about 100 analyst roles and another 4 director roles. We have about 200 applications from across all 4 hospitals. So we anticipate that this team will be truly diverse in terms of all 4 hospitals being represented across many of the different areas that we'll have to build in for the Epic project.
So the ERP team is one team, the EMR team is a second team, but they also come together and they work together because we want to make sure that they're integrated. So they all come together under the umbrella of CareOne. And we have 3 executive sponsors for this, and you are one as our System Chief Information Officer. Who are the other 2?
So we have Fran Spreer, who I think most of us know as our CFO and our COO, and then we have Dr. Cliff Belden, who is the Chief Medical Officer down at Columbia Memorial Hospital.
So the 3 of you are the executive sponsors overseeing this entire project. I was talking to the group today. I know you've had some key hires recently. I was saying to them that, as a health system, as we laid out our strategic plan over the next 3 years, we have 2 foundational tactics that we have to emphasize. And one is our workforce, which is why we always talk about our workforce. And the second is CareOne. And the board is fully behind this. The board is fully embraced it and supports it and knows this is very important for us to do that. So, I'm very excited for this. I hope everybody is. It's going to be a lot of work, and it's going to take a significant amount of effort across all 4 campuses. But when it's done, it's going to be transformative.
Absolutely, and to your point, Dennis, of how important and how much support there is. In my 29 years here, I've said this to other folks, I've never seen a project that has had this much leadership support, governance support, board support across the entire health system. It's pretty impressive.
And again, one example would be in the future, no matter where you go in the health system, whether it be an outpatient setting, a physician's office, one of the urgent cares within the system, inpatient, your medical record visible to the same people everywhere.
For that matter, even across the country.
That's
so
right.
One of the things that makes Epic so special is they have this universe of Epic users, and part of the functionality that comes with being an Epic user is you actually have access to everybody's record who has ever touched Epic before. Right. So even if you're on vacation in Florida and you get injured, doctors up here will eventually have you go to an Epic hospital. They'll eventually be able to see your record for what happened in Florida.
Awesome.
It's great.
Great stuff. Okay, let's recognize 2 more people, a couple more people. We had a Daisy Award recipient. Her name is Cherry Navolta, and she works up in the cath lab. Daisy Award, of course, given to one of our nurses. The person who sits to my right always has the great honor of reading wonderful things said about our winner. So what do they say about Cherry?
And this is great, Dennis. So let me read the summary here. But Cherry was nominated by a patient, and that's so great, who is actually a retired nurse. She described Cherry as warm, welcoming, reassuring, and confident. To quote, "She had a terrific sense of humor, but also knew when to be serious and professional." The patient added, "My husband is a retired professional ballroom dancer, and upon learning of one of the other nurses was taking ballroom lessons, Cherry had my husband dance a bit with her in the hallway." All of this lightened the atmosphere tremendously, easing my anxiety. I think that's just such a great
perfect.
story, and talks to the spirit of Albany Med,
Yep.
and to our staff and everybody who is in this Albany Med Health System universe.
That's
So,
wonderful. Well, congratulations to her. Well deserved. And then last night, you and I were both fortunate to attend the 24th annual Arnold Cogswell Dinner. It's an annual event. It is something that we look forward to every year. It's a celebration, really, of the health system. And a couple important things happen at that. One is it's an opportunity to recognize the people who had been recognized as the Employee of the Year. And since we haven't had it now for the last 2 years, we recognize the last 3 years winners. So Yvette Bruton, I think everyone remembers her from the College Cafe. We had Donald Tessitore, nurse practitioner, who won in 2021. And then this year's Aaron Macbeth, who won in 2022. The last two being both nurse practitioners. So we congratulated them again. And then importantly, we recognize our 2022 Pillar Award winner. Now, the Pillar Award winner is kind of like Albany Med's equivalent of the Presidential Medal of Freedom. It's the highest award that you can get.
Yeah.
And past recipients have included notable physicians like Dr. Pop, right, or Dr. Shaw, Dr. Pietrocola was there. Also people like Jim Barba, very important, influential board leaders. Dr. Lee Powell has won. Last night, it was my privilege to give the award to Dr. Kevin Roberts. Dr. Kevin Roberts had worked here for 40 years. He's a graduate of Albany Medical College. He was chair of the Department of Anesthesiology for over 20 years. And Dr. Roberts really was a physician. He was a healer. He was an educator. He was a researcher. He was a mentor. He was a physician leader in our practice and within our hospital. And he was a great friend of many of ours. So it was wonderful to see him and give him that award. So congratulations to Dr. Roberts.
Great.
Yeah.
And I had the privilege of working with him in clinical engineering. Our clinical engineering
Right.
folks also support anesthesia. And amongst all the other things, Kevin is a technical leader as well.
He is.
He's very astute. So.
Yeah. So absolutely. So congratulations again. So I think that does it for this week. Anything else for you?
That's all I've got.
All right. Well, my great thanks to you.
Thank you,
and
Dennis.
all your team who are working so hard on Care One and really, quite frankly, everything else, but specifically, most recently in Care One.
And we appreciate the support.
We look forward to more updates in the future. That'll do it. I think it's going to be a beautiful weekend. Once again, we thank those that'll be here working through the weekend 24/7, keeping the doors open. We appreciate you now more than ever. And we'll be back again next week. All right.
Thank
Very
you.
good. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you next week.